Dr. Daniel Lieberman joins us as promised, neurosurgeon, founder of the Phoenix Spine Surgery Center. I never thought I would be talking to another man about epidurals. Guys, everybody probably associates epidurals primarily with labor time and women, but that's not really true.
Well, labor is a time that the epidural really works well because you're going to have a pain event which is going to occur, but it's going to be over in at most 8 to 12 hours. The epidural really works through that time. The epidurals in my world, in the spine, low back and leg pain world, are a different story. The pain is sometimes going on for months or even years. And what I'm here to talk about is, does it really make sense to do something that relieves pain for 1 day or 2 days at the most, when the pain is really going to go on for a much longer period than that?
Well, to the person who has the pain, it makes a lot of sense temporarily.
That's really true. And if you're talking about temporary relief, if you are suffering and you just need help to relieve that suffering, it makes sense. But so often I see patients who expect to actually be made better by the epidurals, and that's not the case.
Is there a negative?
Well, there are some potential side effects. And in talking about them, I'd like to first mention that they're rare. But how does paralysis sound? You can be paralyzed.
It can be that serious?
It can. Infection, meningitis. So although they're rare, there are some very serious and real potential consequences.
Are they prescribed too often?
It comes down to what you were talking about, Pat. They're prescribed out of compassion, but when you look at them on a medical basis, they're overused. I'll give you a good example: spinal stenosis. We now have, last year, a randomized trial was done. If you had spinal stenosis, you got one, or you got a fake one. No difference between the two groups. So for patients with spinal stenosis, shouldn't have an epidural.
All right, well, how do I get relief then if I don't have the epidural?
Well, you're talking to a surgeon. So for example, spinal stenosis, the cure is surgery. I think there are conditions that we just can't cure. And if you have one of those conditions, epidurals are a reasonable way to go for very, very temporary relief. But if you have a condition that can be cured, you really should go for corrective treatment.
But as a neurosurgeon, it doesn't come as a surprise to you, I know,
yes,
that one of the lines that one hears outside of the practice of medicine, and perhaps within, is if you can avoid back surgery of any kind, make sure you do. I'm not sure where that came from, but it's always that constant warning sign that we hear.
That's good sense. And that does come from within the profession as well. That's not only back surgery, that's any surgery. If you can avoid it, you want to avoid it. But don't think that just because you're having an epidural injection, which is proven not to help the condition you may be suffering from, that you're going to avoid surgery. You may be postponing what's actually necessary, and that could hurt you.
What are the symptoms of the spinal condition you were talking about?
Spinal stenosis is narrowing of the spinal canal, and the symptoms are really simple. It's pain that shoots down your legs when you walk. Doctors, we call that pain claudication, and it's either from a narrowed spinal canal or a narrowed artery.
So surgery is the only alternative to that?
If the hole's too small, it has to be made bigger to get better. Surgery is really the only alternative as it gets worse. Now, in the early stages, just as you were saying later, we want to avoid surgery by having you exercise, watch your weight, and stay very active. But once it reaches a point where it's really affecting the nerves, you have to have surgery. And that's good because it'll work.
Now, see, I know that as a University of Arizona graduate, that you would never lie to us. So I'm going to ask you a question that I think people are going to be making notes about, and that is, what are the medications, the pain medications, that you like least?
Narcotics. We're going through a really difficult time, Pat. If you are a person who's prone to addiction and you receive a narcotic for well-intentioned relief of pain, it may change your life in a way that you can never change back. It can rob your life, rip your life right out from under you. In the kinds of pain that occur with the back, the best medications are anti-inflammatories. Aleve, if it were by prescription, would be the most popular drug in the world. It is these anti-inflammatories we have available to us are non-addictive, extremely powerful, and really effective for this kind of pain.
All right, so what's the difference between Aleve and Advil and Tylenol?
It's chocolate, strawberry, or vanilla. They all have slightly different chemistries. One might do a lot for you, and another one you may not get any benefit from. So you just have to experiment. The only thing I would add, if you're taking an anti-inflammatory on a regular basis, you have to take something to make sure you don't get secondary acid buildup. And that's your other friend over-the-counter Prilosec.
Tell me about the Phoenix Spine Surgery Center. Would I go to your organization for anything other than surgery?
Absolutely. So the Phoenix Spine Surgery Center is my practice, and it's designed to be one-stop shopping. One of the problems we have with spine care is that it's fragmented. You could have your primary doctor, your pain management doctor, your orthopedic surgeon, your neurosurgeon, your physiatrist. Getting in to see any one of these doctors could take weeks of delay, and once you do, they're not coordinated amongst each other. So Phoenix Spine Surgery Center, I asked the question, if I had a spinal problem, how do I want to be cared for? I want to go to one place. I want to have everything in that place I might need, from consultation, medical management, surgery, pain management injections. I want to get everything I need in one place. That place is Phoenix Spine Surgery Center.
Where you will probably not be offered an epidural when you walk in the door.
Only if we use epidural injections only to test. One of the major misconceptions is the difference between arthritic pain and nerve root pain. An epidural injection may be a good way to relieve for a short time nerve root pain. It doesn't do anything for arthritic pain, it's joint pain. We will use the epidural, if we give you one, we would do it to test whether or not you have arthritic or nerve root pain.
You seem like such a friendly guy. I'm going to ask you something that has nothing whatsoever to do with why you came.
Okay.
Spina bifida.
Yes.
We start with the word spine, and so does your organization.
Yes.
I have a friend with spina bifida. What is it?
So when we're forming in utero, inside our mothers, the spine, which is the backbone, we call it the backbone for a good reason. It anchors all the other organs. So as the spine forms, it has to form segments, and the tissue on the back closes on top of it. Now, if something goes wrong in that process, then the tissue on the back, the segments may not completely fuse together and separate, and the tissue on the back then can't close over it.
Can anything be done?
Yeah, it can be prevented. Routine, this is the shocking revelation of the last 15 years. Routine prenatal vitamins reduce the incidence of spina bifida to very nearly zero.
Will you come back and talk about that sometime?
Anytime you want.
Terrific. And if Dr. Lieberman says so, it must be true.